these Q-tips and also the sides. The sides of these glass is have multiple dead skin cells, and the Q-tip represents the oil materials from your oil gland. So right now, this is whitehead. See, all the oil materials and dead skin cells is contained within the bottle. But when the lid is taken off, and all this oil materials and dead skin gets exposed to the environment, this is now a blackhead. So when it comes to extraction, blackhead is easier to extract either with a Q-tip or a comedone extractor, because there's nothing plugging it. But with whitehead, I typically don't do any manipulation or acne extraction or comedone extraction when it's a whitehead, because it's much harder. If I traumatize the skin too much, it can potentially get irritated and then inflame. And this whitehead, if we extract it, can potentially get angry. But if it's open comedone, we can easily extract all these oil materials, like so, by squeezing together with Q-tip or comedone extractor. Yes. So, yeah. Okay, let me just close this. My apologies. This is the only thing I can think of as far as analogy between whitehead and this is very important. Make sure the cream, the moisturizing cream, is non-comedogenic. Because if it's comedogenic, if this is your pore, the opening of the oil gland in oil products, if it's comedogenic, it can actually create a plug, and that can give you more whiteheads. So, very important. Non-comedogenic. So after you apply the cream, pea-size amount. Let me see. So pea-size amount. Just squeeze a pea-size amount, like so. Palm of your hand. And then apply the Differin Gel. Dot dot. Dot dot. Dot dot. Dot dot. Dot dot. Spread. 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 Massage it in. Do that every day for the first 2 weeks because you want your skin to get used to it, and then work your way up to maybe twice a day. Different gel over the counter is a little weak, so that's why it's okay to go up to twice a day. So once a day for the first 2 weeks, and then once or twice a day after that. Now, I'd like to see you in about a month to see progress. So, what I define for progress is you've changed your cleansing habit. Wash face twice a day with CeraVe cleanser. Moisturize twice a day with CeraVe clean cream, and then make sure it's non-comedogenic, and then apply the Differin Gel on top of the cream. Yes, you got it. So that's your assignment for the next 4 weeks. Okay. Is there